it out of power?
Good morning.
Good
I'm
morning.
Nurse Peace. I'll be your nurse for today. And today we're going to be performing X2 assessment that is going to take about 15 minutes. Before I begin, I'll perform my hand hygiene. Okay. During this assessment, the purpose of this assessment is to get a baseline data about your health to be able to use for any other management. Okay. Before we begin, can you tell me, do you have any pain?
I do not.
Okay. Before we begin, tell me your date of birth, your name, and your date of birth.
My name is Glenn Kenny, and my date of birth is November 5th, 75.
Okay. Do you have any pain?
Nope, I got no pain.
Okay. My client does not have a pain. If he has a pain, I'll ask him what is the precipitating factor, what causes the pain, and what brings about a relief of the pain. And then I'm also going to find out on a scale of 1 to 10, scale 1 being the lowest and 10 being the highest, I'll find out what is the level of the pain. I'll find out what brings about a relief of the pain. But in this situation, my client has no pain. So I will not be performing the OPQRS. Okay. Now we are going to be moving to the neurological assessment. For the neurological assessment, can you tell me what date it is today?
Today, yes, it's June 30th.
Okay. Can you tell me what season we are in right now?
We're in summer.
Okay. Can you also tell me, do you have an idea of where you are?
Yes.
Okay. Fine. My client is oriented to time, place, and person. My patient is very well conscious and alert. So now we are going to be moving to the assessment of the cranial nerves. We are going to be assessing the trochlear nerve, the ocular motor nerve, the abducens nerve, and the facial nerves. For these nerves, I'll be telling my client to carry out some things. Can you smile? Can you puff out your cheeks? Okay, all right. On assessment, my client is able to maintain. Is not there's no presence of any facial drooping. Neither is there any presence of pitosis on his nystagmus. Please, can you cover one eye? What number is this?
1, 2,
Without moving your neck.
3, 4, and 5.
Okay. The other hand. Can you cover the other side?
1, 2, 3, 4, 5.
Okay. My findings, the cranial nerves, the ocular motor nerves, they are all in order because my patient was able to follow my hand movement, was able to follow instructions. Now I'm going to be assessing for the pupils and I'll be assessing for pella. Okay, for this assessment, I'm going to be passing light through your eye. Okay. You just concentrate on me.
Okay.
All right. Okay. Okay. On assessment, the pupils are bilaterally, they are round, they are equal, they are reactive to light, and then there's an accommodation. While the light is being pointed at, it's pointed into the pupils, there's constriction and there's dilatation of the eye, which tells us we have a good accommodation of the for the eye for the pupils. So pupils are bilaterally round, they are equal, there is reactivity, they react to light, and then there's an accommodation. So now we are done with the neurological assessment. We are now going to be moving to the respiratory assessment. For the respiratory assessment, on inspection, my client is breathing normally. There's no nasal flaring. He's not breathing with any. It's not breathing with any accessory muscles. My client is able to breathe well. Okay, now I'm going to be checking the chest expansion while breathing. Can you please turn towards me?
Towards you.
Okay, this way.
Yeah.
All right. Take a deep breath. Again. Again. Okay. On inspection, while the patient takes a deep breath, there's equal expansion of the chest as the breathing is going on. Now, I'm going to be listening to the lung sounds, to the respiratory sounds. On the 9 posteriorly, I'll be listening posteriorly on the 9 landmarks. Okay, while this touch you, I want you to breathe through your mouth. My findings, there's no any regurgitation or wheezing sound. No wheezing sound was heard. No any crackle sounds while the respiratory assessment was going on. Normal sounding, normal breath, normal lung sounds they all heard. Okay, now we are going to be moving to. Can you turn towards me?
Sure.
We're going to be moving to the cardiovascular assessment. For the cardiovascular assessment, we'll be listening to the heart sounds. For the valve, listening to the valve sound, we listen to the aortic, the pulmonic, the tricuspid, and then the ebb sound, and then the mitral. For the aortic sound, we are going to be listening into the on the second intercostal space on the right sternal border. Second, okay. Okay, now I'll be listening to the pulmonic. Same on the second intercostal space of the left sternal border. Then I'll be listening to the ebb on the third intercostal space of the left sternal border. Then I'll be listening to the tricuspid on the fifth intercostal space of the left sternal border. Then I'll listen also to the mitral on the fifth intercostal space of the medial lateral border, where I'll also listen to the apical pulse. Okay. I'm finding the S1 sound is loud on the aortic valve and loudest. The S2 sound could be heard. The lob-dub sound was all heard. There's no any blockage in sound. All the sounds were heard completely. Now we are going to be moving down to the abdominal assessment. For the abdominal assessment, please can you? Firstly, I would inspect. On inspection, there is no any distension or protrusion that can be seen on the abdomen. Now I'm going to auscultate to listen to the bowel sounds, and I'll be beginning my listening from the right lower quadrant. On auscultation, normal bowel sounds were heard. More than 20 bowel sounds was heard. Below 5, that means we have hypoactive bowel sounds. And then when we have above 30, we are having hyperactive bowel sounds. But in this situation, I heard 20 bowel sounds on all 4 quadrants. Now I'll be palpating. Okay, on palpation, there is no any protrusion, no any mass, there is no any fluid collection, abnormal mass collection on palpation, no masses were found, no abnormal mass collection. And now I'm going to be moving down to the extremities, and then also the integumentary system. Assessing the integumentary system physically, the inspecting the integumentary system, the color is same to ethnicity. And now I'll be looking at the extremities. Can you please pull?
Yes.
Okay. Muscle strength is present. The fingers, please. Capillary refill is less than 2 seconds, which is also present. Then I'll also check for the radial pulse. Bilateral radial pulse is present, which is +2. Can you pull back? Okay, I'll check. Okay, can you pull? Okay. Okay. Muscle strength is present on both feet. I'll also check for the capillary refill. Okay, capillary refill is less than 2 seconds. Muscle strength is present on the feet. The capillary refill is also less than 2 seconds on assessment. The radial pulse, tibial pulse, and dorsal pedalis pulse is present. My patient is able to follow commands. The leg strength is equal on both sides of the feet. Thank you. I will now document and I would report to the doctor, report my findings. Thank you.
Perfect.